cranial nerve is known as the nerve of romance, because this is very important in our facial expressions, which make us tell whether we like a person or we do not like the person, and whether we feel disgusted or we feel insulted or sad. And this Bell's palsy is defined as an acute onset peripheral facial neuropathy where there is no identifiable cause. It's one of the commonest isolated cranial mononeuropathies, isolated individual cranial nerves, mononeuropathy, single nerve involvement. The incidence ranges from 11.5 to 40.2 per 100,000 population. Now with the corona, we are seeing a lot of Bell's palsy in the present way. It affects the males and the females equally across all age groups, with slightly higher incidence in the middle and later life and slightly more in diabetic individuals. So what's the function of facial nerve? As I said already, it's a nerve of romance because it's a nerve which gives us a facial expression. This has the motor, sensory as well as the parasympathetic functions. Motor components predominantly supply the muscles of facial expression. Sensory fibers are from the taste from the one half of the tongue, anterior 2/3 of the tongue, and parasympathetic part controls the lacrimation as well as the salivary gland functions. This is a mixed nerve with the 3 nucleus located in the pons, and when the fibers come out, they wind round the abducent nuclei and exit at the pontomedullary junction, and then subsequently it enters the internal acoustic meatus where it is closely associated with the vestibulocochlear nerve. This course is very important because this will tell us when adjacent nerves are involved, it moves away from being a Bell's palsy to some other lesion. And this course of the facial nerve is divided into an intracranial portion and an extracranial portion also. In the intratemporal, when it comes through the bone of the facial nerve, it gives rise to a petrosal nerve. I'll show you the pictures shortly. Now to the stapedius, chorda tympani branches, and exits the skull through the stylomastoid foramen. And once it comes externally, once it exits the skull externally through the stylomastoid foramen, you find that it passes through from here, it passes through the parotid gland and then gives out 2 main branches which again subsequently divide to supply the muscles of facial expression. The terminal branches are known as the temporal, zygomatic, buccal, mandibular and the cervical branches. And you can see the muscles which are supplied are the frontalis. So this is the muscle frontalis, frontal belly of the frontalis. The orbicularis oculi, which helps us to close and open the eyes, and orbicularis oris, which is for the movements around the mouth, the buccinator as well as the platysma. Platysma movement is this. Other muscles innervated are stapedius, stylohyoid, posterior belly of digastric, and then the occipitalis and the anterior and posterior auricular muscles. As you can see, many of these muscles are innervated by the facial nerve. The orbicularis oris is here in and around the muscle. That helps us to pout, and it also is important in gargling, because when you do not close the mouth properly, you can't gargle, and that is one of the features of Bell's palsy. This is a frontalis. So when you do the muscle, then you find your forehead gets wrinkled, and then orbicularis oculi helps for closure of the eyelids, tight closure of the eyelids, and then you have the levator labii, thing superioris, zygomaticus, masseter, buccinator, all helps us for mastication, also part of it for mastication. And depressor and the depressor anguli oris is for moving the lips down. And so from its entire course, from the brainstem till it comes out, facial nerve forms multiple connections with adjacent cranial nerves like the trigeminal, which is the 5th, vestibular or 8th, glossopharyngeal is the 9th, and vagal the 10th nerve. These communications are associated with altered facial sensations, vestibular dysfunction, pharyngeal dysfunction in some cases of Bell's palsy. As you can see, the trigeminal nerve and the facial nerve are in close proximity. Sometimes they develop hypersensitivity over the region of the face affected by the nerve. That can be because of this crosstalk. So when it comes to the etiology of Bell's palsy, though extensive work has been done, the possible cause of the condition is still debatable.